20-year-old Tumisang Motsikwa has undergone heart surgery at Bheki Mlangeni District Hospital in Soweto. This is after he was stabbed in the heart while saving a grade 10 pupil from being mugged outside his school. He got a second chance at life after undergoing heart surgery, which was a first for that hospital. Ahmed Kajee is our reporter who is there at the hospital for us now. Ahmed, thank you for making time for us. So this was a first for that hospital. How is the staff that was involved feeling after this successful surgery?
Thank you very much, Clement. It's a feeling of success and joy over here at the Bheki Mlangeni Hospital, with many of the surgeons, many of the staff members speaking about the complexities of a surgery and a procedure such as this one, but also talking about the fact that the Gauteng Health Department is also going towards improving the healthcare sector across the province to ensure that surgeries such as this one can be carried out not just beyond the major hospitals which we are seeing in Johannesburg as well as Pretoria and perhaps other parts of the country as well. But I'm going to bring into the conversation Dr Ebrahim Ismail. He was one of the head surgeons as a part of the surgery on young Tumisang as that heart surgery had taken place. Dr Ebrahim, thanks very much for your time today. Perhaps just take me through what the surgery was all about, first in this hospital.
So this was a 20-year-old patient who was unstable. He had sustained a stab to the heart. We would normally, under these circumstances, transfer these patients to a higher level institution like Kisani Baragwana Academic Hospital. He unfortunately was too unstable for transfer, so we opted to do his surgery on the premises. So our emergency medicine team resuscitated him. We brought him up to theatre, and we did a median sternotomy, sutured the heart. We got him stable and sent him to our intensive care unit after that. We're just happy that the entire thing was a success.
When you speak earlier about this being a team effort, can you maybe just take us through that?
So it starts at the roadside when the paramedics bring the patient into our emergency room, and then it goes into our emergency room where the physicians there resuscitate the patient, make us aware of the need for theatre. Then we go in and do the operation, and the patient is monitored post-operatively in the intensive care unit and then our general ward. So in that sense, it's really a team effort.
Dr. Sashriqua Palliam, you were also one of the specialist physicians during that surgery. Can you maybe just take us through what it feels like being part of that team, chasing deadlines, chasing the clock as well for that emergency surgery?
I feel very proud that we were able to successfully do this operation here at Bheki Mlangeni Hospital. It's the first time that this has been done here at a district level hospital. This is usually a procedure done at a higher level of care due to just the lack of resources at a district level. The emergency medicine doctors on the floor were very quick to pick up this life-threatening injury and resuscitate him and stabilize him well enough for us to bring him to theatre and operate on him formally.
What does it normally feel like then, having such a positive reaction from the community, from the province and probably the country as well?
Being an emergency medicine specialist, we are frontline healthcare workers, and we generally see or bear the brunt of a large volume of patients presenting to the emergency department and a lot of that comes a lot of complaints. But this is a success story. I'm glad that it has brought positive news for the hospital, and it shows the community that we really are striving to do our best for each and every patient that we do see here at the hospital.
Dr. Ismail, let me bring you back into the conversation. Earlier you were telling us that you were actually deployed out in KwaZulu-Natal prior to moving up to Johannesburg. What has that dynamic and what's the difference like between a facility like this one compared to facilities down in KwaZulu-Natal?
I think it's largely the same. The healthcare system structure with the district, regional and then tertiary level facilities, it's mimicked throughout the provinces. I think I only moved up here to train as a surgeon because there was place at the time as well. But I think that if you're looking for analogies, you would find that in rural areas and where there are district hospitals, the resources are sort of the same countrywide. So there isn't really much of a difference.
And then with the MEC arriving here, providing that recognition, what does that mean to you and your team?
For me, clinically, it's just going to, I would love for the MEC and for other members of high-ranking officials to help us with staffing at my institution. I need more surgeons, and that's what it boils down to. And of course, other facilities, we're talking about equipment, etc., so that we can further district hospitals and we can help our colleagues with the workload in regional and tertiary hospitals as well.
Dr. Palliam, just taking us through this post-op recovery now for Tumisang, what would normally take place in a situation such as this one?
So it's a long road recovery in terms of physiotherapy for him especially, just getting back to his baseline functioning. But with recurrent or with regular outpatient physio, I'm sure he will go back to doing what he was doing.
I mean, he always spoke, he actually spoke to us quite a lot about how strong and brave he was in this situation. Does that give you extra motivation and inspiration to continue doing your job the way you are? There's many ways this is a thankless job.
It is, but again, this is a wonderful, it's a heartwarming success story that really inspires us to just do better and be better.
Perfect. Can you maybe just take us through how it is like? What's that dynamic working like? A young person, more often than not, you would see people who need emergency services or emergency surgery would be perhaps middle-aged or perhaps slightly older.
A lot of the times, especially working in an emergency department, we don't really know the backstories when patients do come in. We have a brief history, 20-year-old male coming in with a stab wound to the chest, but we really, at the time of managing these patients, we don't actually know why he was stabbed, what happened, what were the circumstances around the incident. So it's nice to see that this is a positive story, hearing the story after the event, after managing the patient successfully.
Dr. Ebrahim, bringing it back to you as well. I mean, this was this is the first heart surgery in this hospital. Do you perhaps see parallels to what we had seen about the first heart transplant in South Africa as well?
No, so this was an emergency surgery that's done for a stab heart. I ordinarily would not like to do these here. We feel that they are better managed at a higher level hospital, but we need to be ready for these type of cases at district level if the patient is too unstable for transfer. We don't have a cardiothoracics unit to do that type of elective cardiac surgery, but we're ready for emergencies when the need arises.
Dr. Ismail, Dr. Palliam, thanks very much for your time indeed today. So there you have it, just an insight into what exactly goes into a heart surgery such as this one, the first one at this particular healthcare facility. And as we heard from the MEC of Health, this is going to be the first of many improvements for medical facilities across the country.